Okay, this is a practical assessment of CPR for course number CQ 615082 on behalf of Accomplished Group Limited, centre number 23404. My name is Gavin Casey and my tutor number is 33850. Okay guys, so we're going to look at CPR now, alright? We've done the theory side of CPR on the slides before, which was really interactive, and thank you very much for that. Okay, so we've approached a casualty. Okay, we came into the room, alright, and we saw this casualty lying on the floor, unfortunately, and you are the first aider to provide help. Thinking about the theory side of things, so now I'm going to check your knowledge to see what you can remember. Tell me what I need to do.
Assess the situation.
So how am I going to assess the situation then?
Look for danger around you, so if there's any objects hanging around, that's going to be a danger to yourself or the casualty.
Brilliant. So any danger, so give me some ideas of dangers. Different dangers?
Electrical cable.
Electrical cables, brilliant. Water.
Debris.
Any debris?
Yeah.
Other people.
Other people, absolutely. Normally the biggest one, isn't it? People screaming at you, people are scared and things like that. And it could be somebody wielding a knife around or something like that. Traffic as well, maybe on the M5 or whichever motorway. Not selling any particular motorway, but you know, the M5 is the closest one to here, I suppose. Okay, so we're checking for danger first of all. We're assessing that situation, aren't we? So what happens next? We've come into the room, we've checked for danger, we're quite happy now that, you know, the whole situation is safe for us to be able to continue. What's next?
Response.
Response. Talk to me. Tell me about response.
So checking if they can hear you, asking hello, can you hear me, open your eyes. So just so you can see a form of response from.
Can you remember the scale that we use?
Was it AVPU?
It was AVPU, thanks. So can you remember what they stood for? So what was the A?
Alert.
It was alert. Alright, so checking if somebody's alert. So how can we do that, checking if somebody's alert?
If they can open their eyes.
Open their eyes, yeah. Maybe squeeze your hand or something, yeah? Brilliant. Okay, so checking to see if somebody's alert. What's the V? Can we remember what that one was?
The
Response to voice.
Voice, yeah. So talk to me. How would we get somebody to respond to voice, hopefully?
Shout both ears.
Yeah, both ears. Why both ears?
in case they're deaf in one.
Sorry?
In case they're deaf.
We've got to get you with that one every time, haven't we? Okay. Alright, yeah, so it could be because they've got the hard of hearing in both ears, alright? So we've got to really see if they respond to voice. Hello, hello, can you hear me? Can you open your eyes? Can you squeeze my hand? Can you give me any sort of reaction, facial reaction or whatever, to try and get some sort of response, alright? Now the P,
Pain.
pain it is, and I don't particularly like using the word pain because we're not trying to inflict pain on anybody, are we? You know, we're trying to actually get some sort of response out of them. Okay, and we can do that with a number of ways by tapping the shoulders on the collarbone. We're not going to be shaking anybody at this point in time. Alright, we're going to be tapping their shoulders, alright, and getting some sort of response. There's other things that you can do as well. Can you remember what they were?
Ears.
Ears, what about them?
Pinch it.
So maybe pinch the earlobe maybe. Alright, but again, we're not going to be inflicting any pain because we've got to remember about assault.
Yeah.
And causing pain to somebody unnecessarily as well. So we've got to think of that as well. Brilliant. Okay, so if we haven't got the alert, the voice and the pain, what are we deeming them as? Unresponsive. Okay, so what happens after unresponsive?
CPR.
Not quite starting CPR. So can you remember what the S was?
Shout.
Shout. Brilliant. Yeah, so why is it important that we're shouting for help now?
You don't want to commence CPR and then be doing it for a really long time, not knowing whether an ambulance is coming.
Simple as, isn't it? It can be a very long time as well. And, you know, even just doing a couple of minutes of CPR can feel like a very long time. And you not knowing that somebody is on its way. Now, it might not necessarily mean at this moment in time that you actually need an ambulance. Alright? Because you don't know what the scenario is at the minute, do you? It could be that you just need a bystander to come over just in case that any help is required after you've done the rest of your checks. Does that make sense?
Yes.
Yeah, brilliant. Okay then, so you've shouted for your help. Thank you very much, Matimba. You are going to be my helper today. All right, well done for volunteering. I've just verbally volunteered you myself. All right, so thank you very much for that. Okay, so we've shouted for help. We then need to check A. What is A?
Airway.
Airway. Tell me about the airway. Well done for volunteering.
If there's any blockage,
Checking if there's any blockages. So how do we check the airway before we do the whole head tilt chin lift? Can you remember that?
Visual look.
Visual look. So have a little look inside the mouth, don't we, guys? Yes. To see if there's any objects, any foreign objects in that. What kind of objects should we be looking for?
food particles.
Food particles, vomit,
Dentures or signs of
Dentures.
allergic reaction.
any allergic reactions. What about that breathing problem that people have inhalers for? Asthma, yeah, or it could be anaphylaxis and things like that. Brilliant. Okay, so we're checking for obvious obstructions. What we don't want to be doing at this point in time is a thing called blind finger sweeps. All right, if you start sticking your fingers in people's mouths, what can happen?
You can push if there's an object, then you can push it down further.
You can push it down further. Absolutely. What else?
You could have a seizure and then you could have an injury to your finger.
You
or
could.
loss of form.
You could lose your fingers very quickly, guys, and you're not going to be any good to me as a first aider, then, are you? No, absolutely not. Okay, so yeah, so we need to make sure we're doing that. All right, we're not doing the blind finger sweeps. All right. All right.
Yeah.
So what's next?
Do we check that the airway is clear and check the breathing?
So we've had a look in the mouth. We're checking the airway. We're then going to do what you call, and it's almost like getting a PhD at the end of this, isn't it? I've called it a head tilt chin lift, as I call it. All right. So hand on the forehead and 2 fingers underneath the chin. All right. And we're going to be opening the airway, okay, by doing a head tilt chin lift. All right. Now remember what I said for COVID-19. Okay. So the current resuscitation guidelines specify that when we're checking for breathing, okay, that we're doing the look, listen and feel method as such. So we're just looking to see the chest rising and falling. All right. How many breaths should be in 10 seconds?
3.
2 to 3, yeah. So about 2 to 3. It's where everybody starts sitting and going, yeah, it's quite funny to watch sometimes. All right, so 2 to 3 breaths in 10 seconds, brilliant. All right, so for COVID-19, we could put something over the face, is what the resuscitation guidelines specify, and then check the chest rising and falling. Would we deliver rescue breaths at the minute with COVID-19?
No.
No, but obviously for training purposes, today, guess what we're doing? We're going to be delivering some rescue breaths with our lovely resuscitation shield. Okay, so we have, so we're going to check breathing for 10 seconds, guys. So we said about 2 to 3 breaths in 10 seconds, didn't we? So we can do that under normal circumstances, post-COVID, okay, by the look, listen and feel method. So we're looking down the chest to see it rising and falling. We'll listen to see if we can hear anything and feel anything on our cheek. And we do that for 10 seconds. 4, 5, 6, 7, 8, 9, 10. Okay, unfortunately they're not breathing. I didn't hear any agonal gasps there, and I didn't hear any breathing. Can you remember what agonal gasps were, or agonal breathing?
Just air, just escaping from the body.
Yeah, so the last bits of air
air,
escaping from the body, it's normally a sign of death rather than a sign of life, and it's a sign that CPR is required as soon as possible. All right?
Yeah.
Okay, so Matimba, unfortunately my casualty is not breathing, okay? I'm going to start CPR. I need you to call 999 for an ambulance, please. And I need you to tell them I've got a non-breathing casualty and I'm about to start CPR. If there's a defib, can you bring that back to me? Tell me when you've done that. All right. So now what I'm going to do, rather than go straight into CPR, I'm going to start from the beginning as if it was a live scenario. So we're going to bring you straight in, obviously, when we need to, when you've got to get your defib and things, okay? So I'm checking for danger. There's no dangers, okay? I'm quite happy that there's no danger. Hello, can you hear me? Can you open your eyes? Can you squeeze my hand? No response. Help! Obviously make sure we're tapping the shoulders as well, guys, alright? Okay, making sure I like to shout help in 3 different directions because of sound travel and stuff like that. So we shouted for help. Okay, we're having a little look in the mouth. Thank you, Matimba, for being my helper and coming to the rescue. I'm just going to do the rest of my checks first, okay? Airway's not compromised. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, this casualty's not breathing. Can you ring 999 for me? Tell them I've got a non-breathing casualty. I'm about to start CPR. Can you get a defib and come back and tell me when you've done that? Any sign of that defib?
Yes, I'm trying. My arm wasn't on
Okay,
this way.
switch it on for me. Follow the voice prompts. Quick as you can, please.
Shaving off the hair.
Brilliant. Got to reply to about bare chest.
Shaving off the hair as well, yeah.
Okay, just attach the wire as well into the box. Okay, stand clear, everyone. Can you stand clear, please, Matimba? Thank you.
Shock advised. Charging. Stay clear of the patient. Deliver shock now. Press the orange button now.
Orange button. Yep.
Shock delivered. Start CPR.
Thank you. Okay, stand clear, everyone.
Not touch the patient. No shock advised. If needed, start CPR.
Okay, thank you. Can you switch off the defib for me and then just put its pads back on? Keep that on record, please. At the minute. Thank you. So, things that we need to remember. So what we covered in theory before is about depth and all that, didn't we? Did you notice the speed I was going at?
Yeah.
Quite fast, isn't it? Out of breath a little bit? Yeah? Good luck, guys. Alright, so 5 to 6 centimetres or a third of the depth of the chest.
Yeah.
Okay, going at a rate of, well, 30 to 2, so 30 chest compressions to 2 rescue breaths. Okay, at a third of the depth of the chest, so 100 to 120 beats per minute. So it's almost like 1 chest compression a second. It's quite fast, isn't it? I mean, look at me now, eh? I don't need to go to the gym tonight, guys. All right. Okay, so great. Explaining what you were doing there. I'm just shaving the chest and stuff, obviously, because we want the pads to go into bare skin.
Yeah.
It's really important, okay, that they go in bare skin. Other things as well that we could have put in there is just making sure there's no piercings and stuff. All right, yeah. So there's no piercings. All right, and we're quite happy to continue. All right, so no medication patches or anything like that. No jewelry, no underwire bras. We've got shears in the box. Can you remember?
Yeah.
So we can cut things like that off because it needs to be on a bare chest. Does that make sense?
Yeah.
Yes.
Any questions on that? No? Nobody got any questions at all? None whatsoever? No, we all good? Alright then, good.
What happens if the casualty vomits whilst you're performing CPR?
So, again, slightly what we covered before in the actual theory element is if they're vomiting, we need to get them over on their side and give them a tap, obviously holding their head, and just allow anything to flow away. And then give them a wipe, alright, with a wipe or something like that, and hopefully you've got some sort of resuscitation shield if you feel comfortable to do so, to deliver rescue best. But remember what we said about COVID-19 and things like that at the minute. Does that answer your question?
And you explained this one during the theory session, but I can't quite remember. What is it that I need to do if there's a pregnant female who requires CPR? There's a side you have to put her on, isn't there?
Okay, so you need to tilt the pregnant lady on her left side by rolling up any clothing or a blanket under her right hip. And then you can perform CPR like that, because what it does is it puts pressure on the inferior vena cava, which restricts blood flow back to the vital organs and stuff. Does that make sense?
Okay.
Yeah, that does. Okay, thank you.
All right, thank you very much. You can pause recording for me.
What was it?
Okay, Andre, thank you for allowing me to say your name on the video, but come on in. You've got a scenario here. I'd like you to do a full check as if you're interested.
George! 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 Can you hear me? I've assessed the area. There's no danger. There's no obstruction. There's no bystander in the way. George! 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 Can you hear me, George? Casualty unresponsive. It's gonna check the airway.
What we're going to check first, remember? What we're going to do first before we check the airway?
Check the.
Are we going to ask for anything?
Oh, I was gonna ask my little bystander.
Your little bystander, that's a bit personal, isn't it? All right, but yeah, so you're going to shout for help, aren't you? Yeah?
Help! Help! Hello, can you help me?
I can. What do you need me to do?
I wanted to assist me with this casualty. If you can find a defibrillator and call 999.
Stop right there. Remember what I said. You might not physically need that yet, okay?
Yeah.
So think about it, okay? So start again. So what I want you to do is I want you to go back out the room and stop overthinking things a little bit, all right? And come back in, right? Danger, response, shout, airway, breathing. Then you might need Anthony to do something for you before you start CPR, all right? Grand. Okay, when you're ready again.
Assessing the area. There's no danger. He's unconscious. George! George! Can you hear me? George! George! Hello? Hello? Casualty is unresponsive. Help! Help! Can you help me?
Yes, I
What's
can.
with this casualty? Can you ring 999?
No, remember what I said. You don't physically need that yet. You just need them to say, stay there whilst I do the rest of my checks.
Okay.
All right?
Okay.
That's all right. Go on, continue.
Okay, so that way I do the rest of my checks. I may need you to assist me with the ambulance, but I'm just gonna check. Checking in the mouth. There's no obstruction. Checking for breathing.
Remember, open that airway when you're checking for breathing, yeah?
Yeah.
So get the airway open. Have you checked inside the mouth?
Checked inside the mouth.
No obstructions,
No
okay.
obstruction there.
Get the airway fully open. And remember, try not to close the mouth. Get it right open, Andre. Right the way open.
Like this.
So get the... Right, that's... Okay.
Checking the airway. Casualty is not breathing at all.
How long do we check breathing for, though?
10 seconds.
So can you check it for 10 seconds for me, please? Remember, look, listen and feel. So you need to get that cheek right next to them, yeah, next to their nose and mouth. So you're looking down the chest to see it rising and falling. Listen to see if you can hear anything and feel anything on your cheek.
Can't hear anything, and casualty doesn't appear to be breathing.
Okay.
Right, gonna need you to ring 999 for me, and then try and get a defibrillator as well. And I'll tell them I'm starting CPR.
Okay, I'll come back and let you know when I've got an ambulance on the way.
Just position yourself a bit more correctly. So get to the side of the casualty. Look where you are now. Look at your whole body position.
Yeah.
All right. They've normally got legs. All right. So you were almost kneeling on their legs. All right. So get right to the casualty.
Yeah.
Get yourself comfortable, and remember, you want to be using that upper body strength. Okay. So no bending of the arms or anything, or the elbows. All right. We need to be using our upper body strength and delivering effective chest compressions. So 30 chest compressions at a rate of 100 to 120 beats per minute.
Right, I'll try that.
Yeah. Go for it.
Yeah.
Try and get that consistency right, yeah? 30,
Yeah.
30 chest compressions, 100 to 120. So try not to close the airway. Okay, so no air's going in there. So what things do you need to check for, obstruction-wise?
I'm checking if there's anything in there.
Well, you need to check to make sure the face shield's facing the right way first, don't you? That's better. Right, go straight on your chest compressions now. So if you fail to put in any rescue breaths,
Yeah.
then you need to just go straight back onto chest compressions, all right?
And this one.
So get that airway right open, nip the nose, 2 fingers underneath.
Yeah.
All right, try not to close the mouth. Better. That one went a little bit, didn't it? Okay,
Yeah.
continue.
Andre, the ambulance is on its way and I've got you the defib.
Okay,
I'll phone in and listen to the instructions.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light. Apply pads. Plug in connector. Analyzing heart rhythm. Do not touch the patient.
Stand clear.
Shock advised. Charging. Stay clear of the patient. Deliver shock now. Press the orange button.
Stand
Shock
clear.
delivered. Start CPR.
better rescue breaths there, Andre. Well done. Yeah, went in a lot better this time. Okay, you can stop. Thank you. Hi, can I call you by your first name?
Yes.
Hi, Joseph. Okay, you're in a live scenario now. Please carry on.
Okay. Oh, danger, danger. Oh, who's here? What's happening? Oh, hello, hello. Can you hear me? Hello, hello.
All the way down. You're gonna go all the
Hello.
way down so you hear the
Can you
click.
hear me?
All the way down so you hear the click.
What do we need to do before we do any of that?
Yeah.
Remember.
Oh, hello. Can you hear me? No response.
And what do we need to do?
We need to call for help.
You have to apply the same
I should
pressure.
call for help. Hello, Matumba. Can you help me?
Yes.
Call an ambulance.
No,
and,
stop. Remember, this is where we're going wrong. We might not need an ambulance yet, guys, all right, until we've done the rest of our checks, all right? So all you're doing at this minute, the S stands for shout for help, all right? So we're coming in the room, danger, response, hello. If you think about the AVPU scale, alert, voice, pain, and you get none of that, then you can deem them as unresponsive. You're then going to shout for help, all right? You're then going to just say to that person, can you just stand by? I'm just going to do the rest of my checks first before we see if we need any extra help. So, do you want to come back in the room for me? Okay, continue. It's a live scenario.
Okay. I'm hearing you this.
Hello.
Come back. to this.
Which are you? Hello. Hello. Can you hear me?
Also,
Hello.
I've this one as well.
Hello.
No,
Can you hear me?
So
Hello,
you have to do that as a
I will need
process.
help. Can you be on standby for
No,
me,
you can do
please?
it.
Yes.
Okay. Let me just check the airways if it's blocked.
You can just
The airways is
do it
free.
for-
Nothing is
maybe
blocked. Let me check for
this
breathing.
one.
Right, get that airway right open. Head tilt, chin lift, remember?
You can
That's the one. Look it down the chest to see it rising and falling. Listen to see if you can hear anything and feel anything on your cheek. How long do we check breathing for?
10 seconds.
Beautiful. All right, how many breaths should be in 10 seconds?
Between 2 and 3.
Between 2 and 3, brilliant. Are they breathing?
No breathing.
Okay.
To
Perform some.
CPR, and please can you call the
We know that in
ambulance 999 and also get me a defib if you have
one.
and please
Okay,
come back
I'll be
quickly.
right back.
Okay.
Check for the danger. Hello? Hello, madam? Can you hear me? No response. So it's okay.
Brilliant. Okay, keep going.
Sorry. Okay, there's nothing in my mouth. So, 10 seconds. Okay. Yeah. It's not breathing. Hello?
Okay, I'm here.
Can someone help?
I'm here.
Please,
Can you
can
switch it on, please?
and
listen to prompts.
While I'm thinking, keep going with my process. Yeah?
Quick as you can, live scenario, guys, remember.
Alright, I'm gonna shave off his.
Try not to kneel on the casualty's legs. It's a bit difficult when they've got no legs, isn't it?
Plug it in, please.
Plug it in.
Okay, stay clear. Stay clear, please.
Right clear, guys. You're right next to his legs there, remember? That's it.
Please,
Don't
can
touch
you
him, don't touch
call
him.
the ambulance for me and bring the AED?
Wait for the instruction.
Stay clear.
So I have to go to with the CPR.
Deliver shock now. Press shock.
Where's the shot? Okay.
Start CPR.
Okay, continue. Well done.
You know what I think I'm going to do? Just work this remote.
Oh,
We didn't want rights then, but the first one we weren't working. I think she just went into nose.
You can stop now. Well done. Yeah. Brilliant. Thank you very much for that. End of recording.